Thank you for organizing the event. Once again, all of us that are regular participants in that event, we know that Atelier is an event that attracts a lot of attention, and every year we have more and more attendance and participants coming from different institutions, including academy, industry, many social organizations, startups, and that's the idea to work making networks and connections and start collaborations. There are a number of possibilities we can use in order to enlarge our link between industry, business, academia, and that's how to work for a higher level of research. Today's session will be focused on the possibilities that are offered by the Innovative Health Initiative. And it is our pleasure to welcome Dr. Pierre Meulien, who is the Executive Director of IHI. He has broad experience in the field, being a president and the CEO of Genome Canada, also Chief Scientific Officer for Genome British Columbia. He's been working in the Dublin Molecular Medicine Center as his founding CEO. Also, he has a background in biotechnology, joining the French biotechnology company Transgene after receiving his PhD in molecular biology from the University of Edinburgh. So he has the experience as a scientist himself, and also as a person holding very important administrative positions, organizing different companies, and it would be great to share his experience with us and the opportunities provided by IHI. He will be joined here with his colleagues, Catherine Brett, the External Relations Manager, and Mr. Desmond Barry, the Legal Intellectual Property Officer, also working in the team of Dr. Meulien. So the floor is yours. You're welcome.
Thank you so much, Victoria, for that very, very kind introduction, and a big thank you to yourself, Gergana, and Dimitar from the team, and of course, I know that Buggy has been involved in getting the Nordics side together with you. I'm a huge fan of Biotech Atelier, as you may know. I think I went to one of the first meetings in Sofia. Hugely impressive what you're all doing there, and so happy to be able to talk a little bit about the new initiative, the Innovative Health Initiative. So I think we all know that the manner in which healthcare biomedical R&D is done these days has changed dramatically over the past decades. No longer even conceptually is it thought that a single team or a single institution or a single company can have significant impact in those areas that are the most important for the health of populations. And we have, over the past 14 years now with IMI, we've kind of validated the collaborative model that has been IMI. We've, during that time, a lot of trust has been built, not only among the private and the public sides, but also us being able to create a kind of neutral platform where not only we're able to have the researchers and clinicians and industry experts, but also really importantly, bring in those other stakeholders that are so important in order to accelerate innovation in health. And by those other stakeholders, I mean, of course, the regulators, the health economists, the patients, the payers, and all of the ecosystem that's really required to get innovation into the hands of the users, where the big value is going to be there. So over the 14 years, we've developed and created over 200 projects. These are large-scale projects. I think the average of an IMI project is around the 30 million euro, but we have some much larger ones, 100, 150 million euro. And so we've been able to do things at scale that many others have not been able to do. And at that scale, we can bring actors in from all over Europe and from all over sectors and a wide number of stakeholders. Now, so this has been called the neutral platform, where these people can sit, normal competitors in the industry can sit and agree to share knowledge, to contribute to the projects, and so on. So it has been obviously and also obvious that a partnership between only pharma and the public side through the European Commission was a little bit limited in the scope of things that we could address. So if we're only going to do new innovative medicines, which is what happened under IMI, then it didn't really allow us to do a lot in prevention, in early diagnostics, in other areas that are of potential huge value to health systems. And this has been a big driver for the creation of something new. And so also in the world of technology, there's a huge amount of convergence of technologies going across the sectors of healthcare that's happening right now, and some of that has of course been driven by the digital transformation, but not all of it. And there's a lot in terms of personalized medicine, where diagnostics are joined with the medicines or other interventional possibilities. And we need to take advantage of that convergence, of that technology convergence, in creating this new partnership. Now, we're not starting from scratch in terms of getting other sectors to be involved in our what we've been doing, because obviously, as you know, we've had a big program on Alzheimer's disease, and you can't have a program with Alzheimer's disease without having medical imaging and big data and the rest of it. We can't have a credible program on antimicrobial resistance, which has been a big flagship of IMI, without having a rapid diagnostics. And so we've been building some projects with these players already there. And indeed, in IMI 2, we had one project which was led by a diagnostic company. It was on rapid diagnostics of AMR. And it was, in fact, a project, I think, was around 20 million euro, which didn't have any pharma companies involved in that. So we kind of proved the concept that this could be done. But now we actually have a brand new program where all of the sectors involved in the healthcare R&D are represented at the governing board level and will contribute significant resources to this program. So this is a very natural evolution for us, but it's a big change as well in terms of how things are going to run, how things are going to be governed, and we will be sharing a lot of that information with you today. So I'm going to hand over now to my colleagues, Catherine and Desmond. Catherine from the Communications Department in IHI and Desmond from the legal team. And I think I'm just going to encourage all of you to ask lots of questions, give us lots of feedback, because we're starting this kind of roadshow. We would like to use platforms like Biotech Atelier across Europe to be able to, any opportunity we will have given to us, like you have very generously done today, we appreciate that enormously, and we will take advantage of those initiatives to be able to tell you our story. And we want to get you involved. As you know, in IMI, we didn't have enough involvement in the EU 13 countries. This needs to change under IHI, and we want your ideas as to what we can do to help you get involved. And this is I know there are fantastic SMEs in EU 13 countries, and I think this is maybe an opportunity for them, plus your excellent academic institutions, to get more involved in these large-scale projects that will be run through IHI. So Victoria, Gagana, and everyone on the team, thank you again for allowing us to talk to you and give us this platform. It's really important for us to be able to address our stakeholders and make sure that they can get involved. And I'm going to pass it directly over to Catherine, who's going to start the presentation. Thanks again.
Thank you, Pierre, and thank you as well to Victoria and to the rest of the team for inviting us to be here. I can see that the share button in my panel has now opened up, so I'm going to share my screen. You should be able to see it now. Can you?
It's coming. Yes.
Yes.
I need the full presentation mode.
Okay, I'll just put it into presentation mode then.
Thank you.
Voila. There we go. Okay, so thank you again on behalf of all of us at IHI for inviting us to be here with you today. So Pierre has given you really the big picture in terms of the why we're changing from IMI to IHI. And in the next half hour or so, Desmond and I are going to go a little bit into the details of what exactly that means on a practical level, and really give you some ideas as to how you can get involved in the new program in a variety of ways. So we'll be going through what IHI actually is. We'll talk about the governance, how you can shape our future research, and how you can apply for funding, which I'm sure for a lot of researchers is what they're interested in. So looking at what is IHI. So we're the new partnership for health, and as Pierre explained already, it's a collaboration between not just the biopharmaceutical industry, but the biotechnology, the digital health sector, and also we'll be bringing on board the academics, the patients, and the regulators that we've always had in IMI as well. And it really builds on IMI. So as you will see, there is a lot that is similar to IMI, but there's a lot that's different as well. There's a reason why we've changed name. We are not IMI3, we are IHI, the Innovative Health Initiative. So who are our new partners? On the public partner side, it's the European Commission. As in IMI, the funding will come from the research framework programs, now obviously Horizon Europe. On the industry side, we still have FPIA very much involved, which was our partner in IMI, but we also have COSIR, we have Europa Bio, MedTech Europe, and Vaccines Europe as well, bringing in those other industry sectors, which, as Pierre said, we really need to make progress in health research now. Some things are the same. It's still publicly funded and private funded half and half. We will work through open and competitive calls for proposals. And for all of our IMI projects, we still have over 100 IMI projects up and running. We will keep managing those. All of the contracts we ever concluded as IMI have just rolled over to IHI. So we'll keep managing those projects. And if you want to find out what they're doing, there's plenty of success stories on our newsroom, and we're communicating about them a lot on our social media as well. There are some things that are different. Firstly, our governance structure has changed quite significantly. There's a whole new group which I'll present to you in a moment. And again, the fact that the partnership is broader, and I think it's not just that it's broader, it's really cross-sector. So what we don't want to have is a pharmaceutical project and a medical technology project separated from one another. We really want integrated projects that bring all of the sectors together. And the other important point is that we're really very closely aligned with a number of the EU's other policies, things like the Beating Cancer Plan. And again, I'll come to that in a moment. So our general objectives, we have quite a lot of objectives. I'll go through them briefly in the next few slides. All of them are set out in the legislation creating IHI, which you can find on our website, and there's a link in the presentation here. So on the general level, and these are very high level objectives, there's one obviously to turn health research and innovation into real benefits for patients and society. The other important element is delivering safe and effective health innovations that really cover the entire spectrum of care. So starting right from prevention and going all the way through to treatment. And again, and this is something that we had in IMI, there's a focus on unmet public health needs, unmet health needs there. And again, something which we also had in IMI, but obviously it's broadened out, it's making Europe's health industries globally competitive. Looking at our specific objectives, and these are the ones that are really picked up in the scientific research and innovation agenda. The first one is really on improving our understanding of the factors that affect our health and the development of certain diseases. The second one, again, it's coming back to this cross-sectoral nature. It's about integrating the different health and innovation sectors by bringing them together, and also with other stakeholders. So not just the industry partners, with academics, with patients, with regulators. Of course, the next step is to demonstrate that these integrated healthcare solutions that we'll hopefully be developing actually work. And this is why we really need the involvement of the end users. And if you look at the legislation on IHI, you'll see a lot about the end users, about co-creation. So that's why we really need patients and healthcare professionals involved, so that we can make sure that whatever we develop is actually useful and relevant to them. Another objective focuses on health data. Again, as Pierre mentioned, this is something we started very much in IMI. We have a lot of programs on big data, and we're going to be building on this in IHI. There's a lot of health data out there, but it's easier said than done when it comes to integrating it and reusing it to make new discoveries in research and new resources. And finally, and again, it's linked to the element C and objective C in many ways, we want to develop ways of assessing the value of these integrated healthcare solutions that we'll be developing. So you can see there is a kind of a path along all the objectives to make sure that we develop things that they're useful, that they address a need, that they're useful to the end users, to the patients, and that they're actually feasible and can be integrated and will be actually cost effective. So we have a strategic research and innovation agenda, and if you're interested in getting involved in IHI, I would encourage you to read it. It's available on our website. And as you can see here, the focus is really, again, and I will say this word many times, it's cross-sectoral. It's bringing together these different sectors that we have together fully in the IHI partnership to develop these new products and services to cover the whole spectrum of healthcare. And it's really about laying the foundations for safe and more effective healthcare products that really respond to unmet public health needs and that can be implemented. So in the SRIA, if you have a look at it, you will see each of the specific objectives that I've just run through. It really spells out what precisely are the challenges, how could IHI address them, what could be the outputs of an IHI project, and what would be the impact in the medium to long term. The impact is a really important thing for all EU programs. When we're assessed, everybody wants to know what difference have you actually made, what's your impact been. So this is a really important element. As I mentioned, the IHI really is designed to contribute to a number of EU policies. I've listed some of them here. Obviously, there's Horizon Europe. We are part of Horizon Europe, and in a moment, Desmond will present some of our rules and procedures. And if you're already looking at Horizon Europe, a lot of them will be very familiar to you. The Beating Cancer Plan. There's the Industrial Strategy for Europe, the Pharmaceutical Strategy, and the European Health Data Space. And one other important point, we're also contributing to the UN's Sustainable Development Goal on healthy lives and well-being. So it has a global element there as well. The money is obviously an important question. All of this isn't going to come for free. We have a budget from Horizon Europe of 1.2 billion. The member industry associations are expected to provide 1 billion. And we also have a scheme called Contributing Partners, which is similar to the associated partners in IMI. I'll explain more in a moment, but basically these are organizations that want to invest their own resources in IHI, without becoming full members. And they can do that and have that funding matched by the European Commission. So governance, as I said, this is one area where there are some quite significant changes compared to IMI. At the top level, we have the governing board. There are 8 people on it, and 4 of them are from the European Commission and 4 are from the industry. And as you can see, FPIR is still there as they were in IMI, but they're joined now by MedTech Europe, Europa Bio and COSIR. So these other industries now have a seat at the top table, setting the direction of IHI. We also have a states representatives group, as we did in IMI, and this consists of representatives of all of the EU member states, plus the countries that are associated to Horizon Europe, so countries like Turkey and Norway, for example, they're all on there. And what the states representatives group does, it really makes sure that we're in synergy with any local and national programs. It also provides advice and feedback on our core topics. When we're planning a new call for proposals, this SRG is always consulted. And they're also a good local source of information. So if any of you want a local contact, if you have a question, obviously they're in the national contact points as well, but the SRG members are also a useful source of information as well on IHI. Then we have obviously the director who you've just met and the office where Desmond and I work. And then we have the Science and Innovation panel. And this is new. So why do we need it? Well, you may remember in IMI, we had a scientific committee, which really brought the scientific community's perspective on what we're doing. They gave advice and feedback on all our activities and our plans. And that was great, but it was felt in IHI, we actually need more than just the scientific community to provide input. We need the stakeholders from the wider healthcare ecosystem, so patients, health technology assessment bodies, regulatory bodies, etc. So the Science and Innovation panel will hopefully address that need. They will be doing quite similar work in many ways to the SRG, but with their own expertise. They'll be providing feedback on the work programme, looking at synergies with other programmes. They will also work on updates to the scientific research and innovation agenda, because although, you know, the version that we have now, it's great now, today in 2022, but technology moves fast, and if it needs updating, the SIP will be leading that work or playing a very strong role. So who is on the SIP? Well, firstly, we have representatives of the European Commission and the industry partners of IHI. We also have some representatives of the States Representatives Group. Then on top of that, we have 4 members from the scientific community and up to 6 representatives of the wider healthcare community. We just ran a call for expressions of interest for people who want to represent the scientific and healthcare communities. It closed a couple of weeks ago, and hopefully in the not too distant future, we'll be able to announce who those panelists are. And in addition, I mean, obviously, even with this very impressive and broad group, there may be issues which are not covered by the expertise in the panel. The SIP can also invite ad hoc people to come along and discuss specific issues as well. So the next section is really about how you can really shape our future research, because this is not a top-down program. We really want a lot of it to come from the bottom up, from the users telling us what their needs are, what their ideas are. So one of the ways you can do this is by becoming a contributing partner. So in IMI2, we have the associated partner status, and the contributing partner status works in a very similar way. And as I mentioned earlier, this is really something for organizations that want to invest but without becoming full members. So for example, in IMI2, there's a diabetes charity, JDRF. Their focus is diabetes, and they invested as associated partners in a number of diabetes projects. And, you know, they obviously found it very beneficial. And how does the contributing partners situation work? They contribute their resources just as the industry partners do. So it can be in-kind contributions, it could be their staff time, it can also be cash. It's open to any country, organization or legal entity that wants to contribute to our objectives. The only exception is members or affiliates of the IHI industry partners, who obviously already have their seat at the table via the governing board and things. How to become an associated partner? You need to send a letter of endorsement to the IHI governing board. Desmond is actually the lead contact on this, so if you have any questions, ask him. There's a bit of information on our website now, but basically we're working on some more information that will go public soon that will give you a bit more guidance. But if you're interested, as I said, contact Desmond, he will be happy to help you. And as to why you would become a contributing partner, what are the advantages? Well, the first one is leveraging funding. If you remember from the budget slide I showed you, the European Commission has set aside 200 million euros to match the contributions of contributing partners. So every euro a contributing partner puts into IHI will be matched. So that's a really good way of making your resources go further. Obviously, you can influence the projects far more if you're an investor. It almost goes without saying. There's also the networking element. As we've explained in IHI, we're going to even go beyond IMI in terms of the networks that we bring together. And when we talk to people, certainly from IMI projects, what the biggest benefits are of participating, they often say the networking, the contacts they make, what they learn from people with different backgrounds and different perspectives for them. And so this will apply as well in IHI, but probably even more because, as we said, it's going to be a much bigger partnership, much broader. And then there's the benefits of scale. Pierre mentioned the average budget for an IMI project is around 30 million. These are not small projects. They are big with big partnerships. And this brings benefits of scale, which you can benefit from. Another way you can contribute to our really shaping our research agenda is by contributing an idea for a core project. It could be an idea for an entire project. It could just be something small that would be integrated into a bigger project. We're setting up right now a platform to allow this to happen more easily. But meanwhile, if you have any ideas, do get in touch with us. Any idea that you would have would obviously have to demonstrate how it would contribute to the IHI objectives. It would have to explain how it's aligned with our strategic research and innovation agenda. And it would have to be something that really needs a cross-sectoral public-private partnership. If it's something small that can be easily solved through another structure or another setup, then it's probably not for us. So send in your ideas. If you have an idea, discuss it with us. And basically any ideas we receive, they will be assessed by us and also by our governance bodies. And I would say most notably, the Science and Innovation Panel will play a very important role here in assessing any ideas we receive. As I mentioned as well, will be working primarily through open competitive calls for proposals, and we will need people to evaluate those proposals. So if you want to get involved in that way, please do. Obviously, you need to register on the Horizon Europe portal. And if you're interested, it's probably wise as well to just drop us a line and tell us that you're there and interested so we can look out for you. And if you already have a profile, just make sure that it's up to date as well so that we can make sure we have the most accurate information. Oops, I think I accidentally clicked on the link there. I do apologize. Let me just get back to my slide. Where was I? Ah, yes, the patient pool. So the patient pool, this is something which we had in, one second, sorry. So the patient pool is something we set up in IMI. It's a group of patients and carers who are really living the experience of their diseases, and they bring that expertise to us to help us improve our activities. They've been involved as evaluators of proposals, in project reviews and things like that. Right now, there are about 150 people on the panel. We set it up a couple of years ago. And so the plan now is to reopen the pool to invite more people to get involved with the new and additional expertise. Because, I mean, the patients, as we've said, they are the end users. They're the people who will ultimately benefit from our work. And we want them to be involved in our work in a variety of ways. So I think a lot of you have probably been waiting for this section. How do you apply for funding? So if you go to our website, you will see we do already have some indicative information on our very first calls for proposals there on the Future Opportunities page. We will hopefully be launching 2 calls. The first one will be a single stage call, and the topics are listed here on the screen. As you can see, we have one on neurodegenerative diseases. We have a couple on cancer, so again, contributing to the EU mission on cancer and the EU's wider cancer priorities. And there's another one on health data as well. So what do we mean by a single stage call? So basically here, the important thing for you to note, and Desmond will touch on this in a moment, is that when you apply, there will just be one full proposal that you would need to submit. And you would need to include, obviously, people who are hopefully going to apply to receive funding, such as academics, regulators, patient organizations, SMEs, but also larger industry partners as well, so the big for-profit entities. And then that full proposal would be evaluated, and then we would launch the project. We also have some 2-stage calls. These are similar, more similar to the calls we usually had in IMI. And we have a topic here on cardiometabolic diseases and also on the uptake of early feasibility studies. I'm not going to go into any detail on all of these topics, but there is some more information on our website, so do go and have a look at it there. And the 2-stage procedure, again, here we have 2 stages where the first stage, it's an applicant consortium without the large industry partners. And then the top ranked proposal would work then together with the industry consortium that kind of came up with the topic initially to put together a full proposal, which would then be evaluated again, and it would then go into the granting phase. This is obviously a very quick and speedy overview of how it will work. If you have questions, we can go back to this, but I would also say as well, we are going to organize a lot of info sessions closer to the time of the call launch, where we'll go into a lot of this in great detail. So watch this space is what I would say there. The timelines, very important. So right now on the website, we just have some very short summaries of the topic ideas. It's a couple of paragraphs per topic. Next month, we hope to publish some longer draft topic texts, which will have a lot more information that if you're interested in being part of this would allow you to start thinking about your proposal, to start networking, to start building a consortium. Obviously, the information at that stage is still indicative. It's a draft, things could change, but it would give you enough information to make a start if you want to do something. We plan to launch the call in the middle of June. And the submission deadline for both of the calls will actually be probably around the end of September. And then for the single stage calls, hopefully, obviously there would be an evaluation, and we would expect the grant agreements to be signed in the first part of next year, 2023. For the 2-stage call, the deadline would obviously be just for the short proposals in June. And once they're evaluated, the submission deadline for the full proposals would be early next year, and the grant agreements would be signed in summer next year. So hopefully the very first IHI projects will start in about a year's time, fingers crossed. So eligibility, I'm going to hand over here to Desmond, who is the expert here.
Thanks, Catherine. Thank you very much for that. Good morning, everyone. It's actually great to be here. I think the IHI team, we're always happy to meet new people and disseminate information on our new program that we're very excited about. So what I'm going to do is I'm going to briefly talk about IHI, some of the legal aspects. As Catherine referred to a moment ago, I'm not going to go into too much detail. This is probably better for you because, as you probably know, when a lawyer starts talking about rules, he'll happily spend 2 hours going into the minutiae. But what I will do is talk about first the eligibility issues, the things that you need to know about getting involved in the actual project. I'll make some references. Then I'll talk about the high-level intellectual property rules, which obviously affects all IHI projects. Before I jump into the slides, I would also say we have an info desk facility. And the IHI lawyers and indeed Catherine's communication team, we spend a lot of time answering questions. So please feel free if after this presentation something occurs and and you don't get the chance to ask the question, just utilize our InfoDesk facility. I think it's infodesk@ihi.europa.eu. It's very straightforward. And as I said, we're picking up a lot of questions from there at the moment, and we would be happy to address any legal questions on the basis of these slides. So I think I have about 6 slides here. We'll talk about the eligibility first, then we'll talk about the IPR, then we'll close it out with some communications, and then we'll see if we have any questions. So I think, Catherine, you've got control of the deck, so I'll just ask you to click on this next slide when we go. All right, fantastic. So at the moment, we're looking at the eligibility rules for participation. Now, if you are familiar with Horizon 2020, you'll know that the eligibility rules were very straightforward, and they tried to be as broad as possible to bring in as many entities as possible from different countries and different places. And in Horizon 2020, this was basically found in Article 9 of the Rules of Participation. Now in Horizon Europe, it's Article 22. There are a lot of similarities, but as you can see, we've noted a couple of points here for your attention. So, whereas at the moment, the new rules are that any legal entity or international organization, regardless of its place of establishment, can basically participate, but we need 3 independent legal entities that are established in a different member state or associated country. And the associated country list is quite large. And the details are available on the website. There's a very good source for this that I will come back to in a moment. But essentially, if you are in an EU country or an associated country, then automatically that there are options open to you. And if you're in a third country, then there are possibilities as well. But the key point here, and this is the important red box, is that one of these legal entities, one of the 3, should be established in an actual member state, and that's kind of a carryover from the Horizon 2020 rules. And then the second point is for the IHI specific eligibility criteria. There is built now into the IHI specific rules. This is not the rules of participation, but this is the Single Basic Act. There's a rule that a contribution of 45% has to come from industry or in the form of contributions, 45% of the total cost. And that can be in the form of what we call ECOP, EKA, or FC. Now, those terms, I'm not going to go into too much detail today. Specifically, you don't really need them in this forum, but basically it just refers to either costs which are occurring in the actual project itself, costs which are basically listed as additional activities which are happening parallel to the project but are relevant to the project, or a financial contribution. And a financial contribution really refers to cash from one type of beneficiary to another. And it's very, very frequent in relation to, for instance, contributing partners that Catherine was talking about a few minutes ago. In IMI 2, we had our version of the contributing partners, as she said, was associated partners. And, if you had the big associated partners like the Gates Foundation or JDRF, most of their contributions would actually be financial contributions to other beneficiaries in the consortium. So the key point to remember is that we have this 45% total cost. It's more of an issue primarily for industry, but it also has relevance for single stage calls as well, which I will get to in a moment. If you want more information on this, what I'd do is I'd refer you to the actual Single Basic Act, which is available online, Article 117, and you'll find it there. But if you want a quick, speedy answer on this as well, please feel free, as I said, to use the info desk, and we can give you more information. Can we go to the next slide, Catherine? I think it's actually taken a moment to there we go. I think the slides are taking a moment to refresh, maybe just at my end. So as Catherine said, we basically have 2 types of calls. We've got the single stage call and the 2-stage call. The single stage call, I think, would be familiar to most people here, and it's essentially one consortium which is forming, which is submitting a proposal. It's one single proposal. It's going to include all your information. It's going to include all the details of what you're actually pitching, and it's actually quite straightforward. So those who can actually take part in this, and we have the full list there. So non-profit organization, academics, regulators, NGOs, intergovernmental organizations, it's the full gamut. And they can be from any legal entity established in the member state or an associated country or low and middle income countries. Now, in the bottom right hand corner here, we're talking about the Horizon Europe program guide. If I was, as a lawyer and someone in IHI, to recommend some really essential reading, if you're in this meeting, I would strongly recommend you take a look at the Horizon Europe guide. It's online, it's up to date. I think the most recent version is the 1st of February. It's not that long. It's about 40 pages, I think, and it really talks about all the technical details of relevance when you're applying for calls. So it talks about, the funding structure. It talks about associated countries and identifies them. It talks about low and middle income countries. And if you actually familiarize yourself with that document, it's a great introduction, and then you can move on to the further stages of the legal aspects of IHI and Horizon Europe generally. If there are people in the actual audience who are familiar with some of the Horizon 2020 documents and now they're familiarizing with Horizon Europe, I would say go to the Horizon Europe program guide first, download it, read it, then move on to the specific legal basis or maybe the annotated model grant agreement. Can we go to the next slide? It's going to take a second to come up. Yes. All right. So then for the funding for the two-stage call, as Catherine said, this is slightly different because what we have is we have a preliminary, for want of a better term, an academic consortium, which basically applies at the first stage, and they will put in quite a shorter proposal. But you build that, and then after the actual first stage evaluations, then if you are successful, then that successful consortium then merges with an industry consortium which is pre-identified, and often that pre-identified industry consortium actually has the contributing partners mentioned as well. So it basically brings together the academic and the industry expertise. As we have here, it's essentially the rules are very, very clear. There's one point here that I would draw your attention to, which is in the top left, which is in relation to SMEs. Now, I'm going to maybe go into a bit more detail on this because this is relevant. So as Pierre referred to, we had good SME engagement in IMI 1 and 2. Obviously, we want more SME engagement in IHI. SMEs, they're very, very well placed to participate in the actual projects. I'll come back to this in a later stage, but I think the intellectual property rules are better for SMEs as well in IHI, which is super useful because a lot of SMEs have interesting intellectual property that obviously they have a proprietary interest in, so they can engage with confidence. But the key thing here that we look at for an SME is we basically want to see, is the SME kind of an independent legal entity? If you look at the bottom box in red, what we basically, we're talking about, that box is really geared towards small and medium-sized enterprises. So we basically want entities who are getting involved, who can draw funding, who have an annual turnover of less than 500 million. And it's not just the SME themselves. We basically look at whether they're controlled by larger legal entities, whether they're part of a larger corporate structure, because that's important then as to whether they can receive funding. But if you're from an SME or if you're engaged with an SME and an SME is looking at getting involved in an IHI project, in terms of eligibility, what we want to know is what the actual annual turnover is. Is it below the 500 million mark? Is there a larger entity behind you which would affect that? And then basically an assessment needs to be done as to whether the SME is eligible. So as we can see here, in the second half, in terms of the funding, the pre-identified industry consortium that I was referring to, they don't receive funding in the program under the two-stage call process. Basically, as I said, their job is to come in and they bring in the contributions, part of the 45% contribution that I mentioned in the actual last slide, and they also, they bring a lot of in-kind and expertise and such. So it's a real marriage of the academic expertise and then the resources of the industry. Can we go to the next slide? I'm not seeing it come up yet.
It'll be there in a second.
Okay. Is it our slides that are a bit lazier? There we go. All right. So as I said, this is my territory. This is the intellectual property. So what I would say, I'm not going to spend 2 hours talking about intellectual property, much as lawyers often like to. But what I would say is, I'll just go through a couple of slides here, the key points in relation to the IPR. And then, there will be, as Catherine said, there'll be an awful lot of information following on this in later webinars and later briefings. And we have the InfoDesk facility. And IHI, we have 3 lawyers now, and they're all quite good on IP. So we're confident we can address any queries that might crop up. But starting off, if you are familiar with either IMI 2 or Horizon Europe, you'll know that in our legal basis for IMI2, we actually had specific derogations where we basically said, okay, the intellectual property rules for Horizon 2020 are this, but IMI2, we're going to do our own thing slightly. And we had slightly different rules, which was actually quite useful. It gave us a lot of flexibility, but it did cause quite a lot of questions for beneficiaries that were coming from Horizon 2020. And we're kind of saying, well, why is this different and what effect does this have? So in a streamlining effort, which has its own advantages, basically now the IHI intellectual property rules are very, very similar to the baseline, normal, run-of-the-mill Horizon Europe intellectual property rules. So if you're familiar with Horizon Europe intellectual property, 98% of IHI is exactly the same. And as you can see here in the second bullet point, we basically say that the IHI intellectual property rules are coming from three sources. The normal Horizon Europe Model Grant Agreement, Article 16, that's normal, supplemented by some specific rules, which again are in the Horizon Europe Model Grant Agreement in Annex 5, which is at the back. And then we have, it's possible that there will be a few IMI specific rules that will appear in the applicable call conditions. And I'm going to refer to those in a moment. But basically, as I said, if you know Horizon Europe IPR, if you're comfortable with that, then IHI won't present any difficulties at all, so long as you read the call conditions. A couple of the main points, and this actually is not IHI specific, it's basically across the program, but we have the right under IHI-JU to object to transfer of ownership results or to grant of exclusive licenses. Now, for the audience here, this isn't actually going to present, I would imagine, a problem. This is something which is hard-coded into the rules. It's a discretion which the IHI office will exercise. It's going to be in very, very specific conditions, and those conditions have not yet been finalized. So it's an ongoing discussion, but suffice to say, it's an option there. We don't anticipate using it all the time. Of more interest to everyone here, I think, is that the plan is at the end of every single IHI project now, there will be a definitive final results ownership list, which will be compiled. And basically, this is really fantastic from an IP tracking point of view. So the idea is a project will be able to say, we finished the project, these are all the results that were actually generated, this is who owns them, this is what the status of them actually are. And then it's much easier to track it. And as we have there in the last point, this includes situations where we have joint ownership of project results as well, because then it will be clear, even if a result has been generated jointly in the actual project, we basically identify all the owners, which will make the process very transparent. Can we go to the next slide?
Should be on its way. We're sitting in offices just a few meters apart. I could probably run around and give the slide to Desmond faster than the internet's giving it at the moment.
Yeah, it's kind of like being on the moon. There's like a 3-second delay. So the second slide then, as I said, yeah, IHI, in keeping with the rest of Horizon Europe, there's a real emphasis on exploitation and open science. So we're integrating the open science dissemination model. We have these affordable access provisions. This is interesting. So again, this is one of these things which is put into the IHI legal basis quite specifically. It's a little bit unusual for the rest of Horizon Europe, but essentially what it means is that a certain limited number of projects these provisions may kick in, which has downstream implications for the pricing of products that potentially come out of IHI projects. So again, this is subject to a lot of discussion. It may be integrated in a limited range of projects. Discussions are ongoing, strategic discussions, which the legal team, we don't take that final decision, but this will be clearly marked for IHI projects where these affordable access provisions do apply. And again, the third point here, which is much more interesting for our room, is that unexploited project results can be matched with interested parties via the Horizon Results platform. So before, in IMI 1 and IMI 2, some really fantastic results were actually being generated, and the uptake of those results were very high. But there was always a concern that, if you're actually funding these projects and if you're generating these really interesting results, you want to make sure that downstream endpoints are reached, and you want to make sure that that those results are carried on and exploited to the maximum effect. So the idea here is that if this project results from IHI, which aren't actually exploited or are kind of sitting there, we can use the results platform to match them up with people who may be interested in exploiting them. And again, the results list at the end of the project that I was talking about earlier This and the Horizon Results platform, it makes it clear and very transparent as to what project has produced what results, what's available, what's useful there, what could be of interest to others after the end of the project. And I think it's going to be a fantastic functionality. We're very excited about it. And then a couple of closing points, which kind of reiterate what I was talking about before. But if you are familiar with IMI2, I said there were some specificities that kind of always raised eyebrows for people who were coming from Horizon 2020. So what we're saying here is that there have been some changes from IMI2 to IHI. If you are familiar with IMI2, what's to keep in mind is that the access rights now, as I said, in terms of access rights to background, access rights to results, they're now consistent with IHI. So as I said, if you're familiar with IHI, super, then you're familiar with the IMI2 access rights in general. And secondly, IMI2 had a very specific access right for third parties after the end of the project to results and possibly background for research use of those results. That has been discontinued in IHI as part of the streamlining process. So just bear in mind that that function won't be open to IHI projects if you may have exercised them or seen these in use in IMI2. And then we just put this brilliant little point down at the bottom just to remind everyone. So the high level rules that I'm talking about here, of course, they're going to be reflected in all the IHI projects in one way or another, unless of course it's something like affordable access provisions, which won't apply everywhere. But the high level rules that I'm talking about are fine, but in your consortium agreement, when you are actually becoming part of a consortium, when you are getting ready to launch the project, it's in the consortium agreement that the day-to-day reality of these rules is going to be reflected. And, you know, it's in that consortium agreement that you have to be familiar with, because that's going to identify your background. And that's going to talk about, you know, what everyone's bringing to the project. And that's going to talk about the rules, the intellectual property rules, how the results are actually going to be managed between beneficiaries. So if you get involved in an IHI project, don't neglect the intellectual property aspects of the consortium agreement. The consortium agreement, you know, it's negotiated between everyone. IHI are there for advice because we don't sign the consortium agreement. So if you get to that stage and you have a question in relation to it, please feel free to again fire the question at the IHI legal team, and we're always happy to provide advice or guidance on the consortium agreement as well. So that's our intellectual property slides. I hope that wasn't actually too painful. If we move on, then we're just going to close it out with a couple of other interesting points. I think our next slide is.
It's on IHI. Find out more.
Ah, great. All right. Okay. So this is actually very relevant because since we had the IHI Info Day, the launch day, about a month ago, we've received an awful lot of questions by very, very excited potential beneficiaries saying, this is great, how do I get involved? And they say, I want to be matched up with a consortium. So what we always say is that IHI, we're not in the business of, we don't build the consortia. What we try and do is basically encourage as much participation as possible. So it's up to actually the people who want to join the consortium to kind of find each other and basically build these consortia that would be most effective in addressing the subjects that are raised in the call texts. So as we have here, we basically say it's up to you guys. You need to build or join a consortium. You need to read the draft call text as soon as they're published. And start networking. So for instance, if there's a particular topic, what kind of particular beneficiaries do we need? What kind of expertise do we need? Sign up for our webinars on the call topics and our rules and procedures. And Catherine and I, based on experience in IMI2, we will be doing a lot of these in the coming months and years, where we'll go into more detail, both on the call topics and on the applicable eligibility rules and on the intellectual property. We do have, I'm reliably informed, a brokerage event coming, which is going to be great for meeting other potential beneficiaries and participants. Catherine, I don't think we have a date for that yet, but it's in train. Would that be fair?
Yeah, it will be around the time of the call launch.
Yeah, great. Okay, so early summer. And then lastly, as we said, we have use the online partner search tools as well on the funding and tenders portal. And then there's a link down at the bottom, which you actually may find useful, which is general advice. But again, we won't take an active step in linking you to other consortium members. That the onus there is on you guys. Next slide. Stay in touch, right?
Yeah.
Super. All right. So Catherine and the colleagues in the communications team do an absolutely fantastic job in pushing out information and making sure the website's updated. So we have that particular section on our brand new IHI website, which basically has useful links, and I'm sure that's going to acquire more links as we actually go forward. I would remind you of the actual info desk as well. Next slide. Yeah, and then we have some social media. So there's the newsletter, there's Twitter, there's we're on LinkedIn, and then there's great, the info desk link is there. So if you actually send a legal question to the info desk, I guarantee you it will land on my desk quite shortly thereafter, and then me or one of the other lawyers we can answer it. And I think that's it. So that's our slide deck. So again, thanks for having Pierre, Catherine, and myself. It was absolutely fantastic. We're happy to take any questions if you want to field them. Otherwise, it's been fantastic. Thanks.
Yeah, I will also just say thank you, and I will add as well. I mean, I realized throughout the presentation we've referenced quite a lot of documents, you know, various Horizon Europe guides, our research and innovation agenda, the legislation. And I know it takes quite some time to read through these documents, but as a general piece of advice, and this is valid for any research program, not just IHI, if you're thinking of applying for funding, it really helps if you understand the program and what it's trying to do, because that way you can make sure any application that you put together is at least likely going in the right direction. And won't be dismissed out of hand for being ineligible or out of scope completely. So do take the time to read those documents. And if you have any questions, do ask. And again, from our experience in IMI, we see that the successful consortia are the ones that have taken the time to ask questions. If something's not clear to them, they ask us. And that really, it gives you an advantage if you understand things. And on finding partners as well, I mean, I think the top piece of advice again would be prepared to invest time in finding partners, because again, from IMI, I know that speaking especially to smaller organizations or maybe to younger researchers who aren't so well networked, it takes time to build those networks. So I would say even if there's a topic you're not interested in yet, it's always good to have a network. And then if a topic comes up, whether it's in IHI or a completely different program, if you have a network already, it's much easier to activate it and start putting together a consortium. So I think those would be my closing bits of advice. And finally, as I say, I know we've given you a lot of information. We will have webinars dedicated to just what we covered in 2 slides here, a whole webinar closer to the call launch. So do follow us on social media, sign up for our newsletter, and you'll get all the information on all of our events that will explain in much more detail and much more calmly all of how you can get involved, how you can apply for funding. So thank you. And I will hand back, I'll stop sharing and I'll hand back over to Victoria.
Thank you very much. It was really a very valuable information and advice. And we're very, very thankful for what you shared with us. And your new site is really great. The website, it offers a lot of information. Most of the hints that you shared with us are available there. So I would like also to encourage colleagues to visit that website. And as we have a few minutes, I would like to ask for any questions from the audience. And till they are thinking about questions, I would like to put 2 questions if possible. The first one regards our very, very low success rate considering Bulgaria's participation in IMI. We have just one successful project in COL23 represented by the Bulgarian Association of Personalized Medicine. What do you think is the reason, apart from the low submission rate of projects, is that we're lacking expertise or courage to participate or administrative capacity to shape a project so that it answers the requirements? I'm just wondering what the real reason for that is. First, and my second question maybe goes to Desmond. Are partners expected to provide co-funding in case they are successful in a project. Yeah, thank you.
Okay.
But, I mean, in relation to the first question, speaking as someone who's Irish, and you know, there's not that many Irish. There's some, but there's not a huge number of Irish contributions either. I think. I mean, speaking as someone who, as a lawyer who has just observed the actual evaluations, I think it's. I mean, we get such good independent experts to evaluate proposals. I think that. I don't think it's really a national issue at all. I think it's more a case of you need, when you're actually applying for answering these actual calls, you need to basically bring, you know, your full game. So it's about expertise, it's about building the right consortium, and to come back to something which Catherine said, which I think is super important, it's about making sure that you really address what's in the topic text. And so if you're addressing what's in the topic text and you show that and if you understand the rules, that allows you to answer the topic text and address the concerns in the topic text quite specifically. I'm just talking about maybe some of the Irish proposals which I'd actually witnessed. There is a temptation sometimes to say, okay, the topic text is on X, and this is my take on it. But you're not necessarily addressing what the topic text is asking for. So I think, you know, in terms of success at the evaluation stage, I think, to go back to Catherine said, it's absolutely essential. You read the topic text back to front. You understand what they're actually asking. Then you go get the expertise and you say, okay, we have the experts who understand actually what they're asking in the topic text, and we understand how to answer it. And then the third part is we understand the rules and how, you know, the project will actually run, and basically, you know, how to manage funding and that kind of thing. So I think the best thing I can say is, if you want to be successful, you have to have a basic competence and understanding in what's being asked in the actual topic text. And then after that, as I said, we have really, really good independent evaluators. They don't mince their words, and they generally have very strong opinions. And you know, then it's a case of satisfying them that your proposal is actually the best, because Catherine may have more information on this or a more informed view. But just as a lawyer who's always on the sidelines, just providing legal support, I think the quality of the proposals that we receive sometimes really is quite staggering. So you want to make sure that, as I said, you bring your full game, and you're integrating all the components: your team, your approach, your knowledge, and your expertise.
I see. Yeah, thank you. Yes, addressing the topic is the essential part. That's the first to start with. Yes, thank you. Thank you.
And then, sorry, on the second point, I think it was about co-funding. No, so as we basically said, I mean, the key point here is that if let's say, if you're an academic, basically, then you will be coming in, and we would expect most of them to be applying for funding, which is clear. So contributions are possible as well. We would expect contributions to primarily come more from industry. But so under the traditional model, what we basically have is, as I said, mostly the academics and the SMEs receiving funding through the actual program. And they really do bring some niche brilliance to the actual project, you know, and then industry partners are constantly surprised by just the quality of the research and the quality of the people that the beneficiaries who are receiving funding bring. So contributions are possible, but I haven't actually seen that on display yet. But as I said, most of the funding, or most of the contributions, will be coming from industry partners.
And just as a quick question, which maybe other people have, what is the funding rate for beneficiaries receiving funding?
Is it 100%? I think. So, Joe, because there was some discussion on that. I will actually just check that and refer back. I think we're still for beneficiaries receiving funding. I think we're at 100, but there was discussions for 70. I will check that, and I'll just send the response through to, I think, the team here, just for clarity.
As you can see, IHI is as new to us as it is to you in many ways. We have a few months head start on you, but we're still learning a lot ourselves about how and some things, as Desmond mentioned in his presentation, some things are still being decided now. So
Yeah,
it's a brand new program, which is very exciting, actually.
yeah, we have a lot of work to do in the next couple of months.
And that's exciting, of course. Any questions from the audience? Anyone?
No one dares to ask a question, but yeah, congratulations from several participants, and most of the people are waiting forward to see the specific calls coming. And I really hope that Bulgaria will be more active and successful within this initiative.
Yes, I'm sure that this.
I
question
would like
will
to
help.
echo Catherine's words about fasting and having profile in these partner search platforms. I think that this is one of the formula of success, and that's how Bulgarian Association for Personalized Medicine actually jumped into a great consortium and now is running a Screen for Care project within IMI2. So yes, please describe and let people know what you are doing and what ideas and expertise you have, and you will find a partner in consortium, hopefully.
Yeah, I mean, we are aware that finding partners, like I said, especially for certain groups, it is the biggest challenge, and you just really have to invest the time, pick up the phone, call the top people, and you know, if you see you have some expertise or resources that are required in the topic text, you know, you have to sell yourself. It's marketing actually at that stage. Really market yourself, especially if you know, if you find out that someone is putting together a consortium, call them and say, listen, I would be great in your consortium because I have this. It's, you know, it's sales and marketing at that stage.
Absolutely.
And don't be shy.
Yes, it needs courage and initiative.
Yeah.
Fine, thank you, everyone. And I hope that we shall meet again in the next Biotech Atelier sessions. And the most important part of the story that you presented is to encourage people to apply. So we'll be happy to have as many applicants as possible from Bulgaria and to have a successful project in IHI as well. So that's what we are craving for. Thank you to all of you, both presenters and participants, and see you soon, hopefully. Take care, all of you. Bye.
Bye.
Thank you very much.
Bye and good luck.
Bye-bye.
Stay healthy and
Thank
stay
you.
bye.